what would you list as kind of the root cause factors that, need to be looked at when somebody's developing an autoimmune condition like Hashimoto's or Graves' disease?
Yeah, so there are definitely different factors. It's what's called, I'm sure you're familiar with the triad of autoimmunity, also known as the
Mhm.
three-legged stool of autoimmunity, where you have genetics, exposure to one or more environmental triggers, and then an increase in intestinal permeability, which is a leaky gut. And so obviously we can't do anything from a genetic standpoint, but thankfully by finding, removing triggers and healing the gut, those could be big factors in reversing the autoimmune component. And so, starting with the gut, I mean, again, according to that triad, everybody with an
Mhm.
autoimmune condition has a leaky gut. Some question that, but still very prominent. So, if not everybody, most people have a leaky gut with Graves, Hashimoto's, other autoimmune conditions. So, just finding the factors that are disrupting the gut. Is important. So, whether it's foods such as gluten, which also could be a direct trigger, and not just a leaky gut trigger, and then infections like H. pylori, parasites, which again also could be a factor directly, and we could talk about those after. But yeah, just what's causing the leaky gut, and because a lot of people just jump into like gut healing, like drinking bone broth and taking L-glutamine, and those are great, but you want to find out what's disrupting the gut. So definitely healthy gut necessary for healthy immune system, as most of the immune system cells are located in the gut. And then as far as the different triggers, so I mentioned a few of them, like food sometimes could be a factor, such as gluten, dairy, even corn. And then we have, I mentioned infections, like certain infections, such as I mentioned H. pylori, which is a correlation with both Hashimoto's and Graves in the literature. Epstein-Barr, which is a virus that could also be a factor. Even stealth infections, such as, well, viruses are stealth infections too, but Lyme disease, Bartonella can also be potential triggers. And then stress. I mean, stress is a big factor too. Just in, I would say, at least from what I've seen, even more. I mean, with both Graves and Hashimoto's, all different autoimmune conditions, but even in the literature under Graves, it shows that stress is a big factor. And we could be talking about chronic, everyday stress. We could be talking about like childhood trauma, which is also quite common. But either way, you want to do things to help with the stressors. I mean, some things you could do on your own. You could definitely block out time for stress management, incorporate mind body medicine. In some cases, you might need some additional help, maybe speaking with a counselor or working with someone else, especially if there's, past trauma in your life. Um, and then toxins, environmental toxins. Obviously, we live in a toxic world. It's not getting any better. There are so many different environmental toxins out there, and some of them can directly affect the thyroid, and some of them can affect the immune system. Some of them can affect both. So, like some heavy metals, such as mercury, can directly affect the thyroid and also affect the immune system and be a potential trigger of Graves or Hashimoto's. And then we have xenoestrogens, such as bisphenol A, that also could act as endocrine disruptors and affect the thyroid, but also could affect the immune system. And, glyphosate, which is, as you know, the ingredient in the herbicide Roundup, and that could cause dysbiosis of the gut microbiome, which, could also be at least a factor in the
Yeah.
development of Graves, Hashimoto. So again, too many toxins to talk about, too many toxins to test. You can't even test for everything out there. So yeah, but mold, toxic mold I didn't mention. I mean, that also could be a potential trigger. Also could affect the gut microbiome, those mycotoxins. And yeah, again, and nutrient deficiencies. I should mention that as well. I don't really consider them necessarily a trigger, more so of an underlying imbalance. So if someone has like deficiencies in vitamin D, selenium, zinc, other nutrients I mean, all the nutrients obviously are important,
Mhm.
but those, when it comes to thyroid health and the literature, vitamin D, a lot of research with vitamin
Yeah.
D and Graves and Hashimoto's, and selenium definitely is one of the big ones as well.
Yeah, vitamin D with autoimmune conditions all across the board, all autoimmune conditions with vitamin D, we're seeing that quite commonly. People aren't getting out in the sun like our ancestors used to.